All right, we are live, and it's funny when I started this live through StreamYard, it comes up and says, "Good lighting will help you make you look really good." And when I look at this, I probably should have shaved or something because I'm not looking too good at all. But anyways, that's not why we're here. So last night I came on and talked a little bit about doing the stuff you're really good at, taking your patient preferences, and then starting to incorporate more research into your practice, which is something that I hope that most of us are trying to do. And if we aren't trying to do that, then hopefully that's something that we're going to endeavor to start doing because it's really important. And then, of course, we inverted that pyramid and made it look like a little bit more of a funnel to where the research was at the top and we were doing more of the research stuff. And then we were looking at patient preferences, and that stuff that we were really darn good at changed to where the thing we're really good at is giving a good massage. But now we were also really good at looking at patient preferences and incorporating research and doing some of those other things. So now, if anybody was on the page this morning and saw the graphic that I put out, we're going to talk about what you do once you've started to incorporate more of that research in and you're starting to get more of a grasp on, say, the clinical guidelines of things, and you're reading more research and trying to integrate that into practice. So if you didn't see the diagram this morning, let's bring it up. And there it is. So when we look at the clinical guidelines, most of the time it recommends doing some education, some reassurance, some movement, and some massage. Now, we all know that all of us are really good at doing a massage or delivering a massage, doing that thing that helps people feel better when they come in. But I know myself, and I would say most people probably have some work to do around delivering some education, some reassurance, and some movement to go with that great massage. But I thought I would take a chance just to quickly talk about the education and reassurance end of it. So when we look at the reassurance, there's a lot of things that we can provide reassurance about. But quickly, when a person first comes in and we're looking at their intake form, we can start to provide reassurance really quickly when we can rule out red flags. So when we can look at things and look and see that they don't have cauda equina, that there's not a history of cancer, that they haven't suffered significant trauma, they're not having issues with bowel movements or sexual health like erections and things like that. When we can rule those things out quickly on an intake form, then we can provide reassurance to the person that for one, they're probably safe to move and they're probably safe to get some treatment where you can help them out. So giving them reassurance that they're not broken and they don't have a serious disease can go a long way to helping somebody, because quite often we have people come in who are really worried because they're experiencing some pain and they're worried that there's some major tissue damage. They're worried that they have a serious disease or there's something else going on. And by all means, if we see those red flags, that doesn't always mean that you can't continue with the treatment, but it might mean that you need to refer the person out to a doctor or something that to get some testing done. So one of the things that I like to do is, because I have that background as a first aid geek, is I also, when I'm talking to the person, I'll ask them questions like, well, when the pain started, did you hear a pop? Were you in a rollover car accident? And that's an important one because, if you have somebody who says they were in a car accident, making the differentiation between the two of a rollover car accident, or maybe it was just a rear ender going 5 kilometers an hour in a mall parking lot. That's two very different things. Asking if they had a fall from a height. Did they suffer a blow to the head, neck, or trunk? So those are some of the things that I like to ask, just to rule out that there isn't any major tissue damage that's going on with this person. So those are some great quick ways to provide reassurance. And of course, as treatments go on, there's a lot more reassurance you're probably going to have to do down the road. But those are some really quick ones for when that person first comes in to see you. And then we look at education. So once we've done all that reassurance, we can use those things as a way to educate them that they're safe to move and they're safe to get treatment. And we're probably going to have to do some other education, because if they've been referred over from, say, another practitioner, they may have some ideas in their head that there's, trying to think of how to say this right. When we look at some of the narratives in manual therapy, a lot of those narratives are wrong, or they're giving the person a false idea of what's actually going on with them. So we may have to give them some education around some of the narratives that they've been told. And it's really all comes back to the same thing. It's all a way to just show them that they're safe, or expressing them to that they're safe to get treatment, and that there isn't major tissue damage going on. Okay, so once we've done some reassurance and some education, then we can do some movement with them. And honestly, when we look at the literature, and if we're just looking at something as simple as low back pain, not that low back pain is always simple, but one of the big recommendations for exercise for low back pain is just simply going for a walk. I don't know how many of you have ever had the chance to go for a walk with a patient, but I totally recommend it. It can be very helpful for somebody who's dealing with back pain. And the exercise doesn't always have to be supervised exercise. It can be that you send them home with some exercise that they do. Maybe it's just a simple matter of going for a walk at home. And one of the guidelines that's out there that talks about movement and exercise for low back pain actually recommends avoiding fancy equipment. And I know as massage therapists, quite often we think that we need a bunch of fancy equipment and we need a gym in order to be able to do movement with people, but you don't. And actually some of the guidelines recommend not going that way, and recommending not using fancy equipment, and saying that it doesn't have to be supervised exercise. So these can just be recommendations that we give them to go home with. And then of course we are going to deliver a good, delicious feeling massage. And this comes back to a little bit of that education stuff as well, because that may be, as I talked about with some of those narratives, where we have to do a bit of education, and of course educating ourselves to get away from some of those narratives from maybe some of the modality courses that we've taken. But do what you do best and go back to those patient preferences, because they really like the way that you treat. That's part of the reason that they're coming to see you. But we want to avoid a lot of those harmful narratives that are associated with some of the modality techniques. And really, the technique that you use doesn't matter, because all of the techniques that we use have a neurophysiological input. It's all about interacting with the skin and interacting with the nervous system. So whatever your favorite technique is, then by all means do that technique. But if you're using a narrative that isn't talking about the nervous system, then we can talk later about changing that. But that's something that you want to look at. But one thing that I find interesting is that we should always be trying to approach these things from a biopsychosocial lens. And of course, we talk a lot about that when we're dealing with patients. And of course, biopsychosocial has been a hot term over the last couple of years. But I don't think anybody that I've seen anyways has really talked about how the biopsychosocial would apply to us personally in practice when we're looking at our career. And this is something I just kind of recently thought of. So you can totally tell me I'm an idiot for thinking of it this way, but I think of the bio as sort of the things that we're doing when we're interacting with patients. So when we're talking about, like, if we were using the biopsychosocial lens with a patient, when we're talking to them, we're talking about the biomechanical or the biological things that are going on with them. So I kind of look at that as our treatment, our modality would be the bio for us. When we look at the psychological, then that's the education that we do, the learning that we do, the things we're doing to make ourselves smarter, the research that we read, the clinical practice guidelines that we're looking over and trying to implement. So that would be the psycho for us. And I think quite often when we're looking at learning, it's quite often through weekend courses where, somebody's teaching a modality course or something like that. And hopefully some of that learning is reading that you're doing online. For instance, I know a good blog that you could go to that has a lot of evidence-based articles on it. So doing some of that learning, reading research, doing those things. And then I look at the social. And the social is really the community of other therapists that you're around. So quite often, when we're looking at evidence-based guidelines, it's talking about a multidisciplinary clinic. So maybe that's the social part of your career. Maybe it's the therapist that you went to school with that you're still friends with. Um, the people that you're interacting with. And there's a great quote that I'm going to read. It's from a motivational speaker named Jim Rohn, or Ron, Rohn. He says, you're the average of the 5 people you spend the most time with. So if we looked at that and applied it to our career and went, okay, well, what other therapists am I talking to about this stuff? How am I learning? How am I interacting with these other things? I don't know about you, but sometimes I feel like I'm in a void when I'm at work, especially now because I'm working from home. So I'm working by myself. So I don't have other clinicians to talk to. And even when I was working in other clinics, it was quite often that, you'd go do a treatment and then you'd be coming in, changing your sheets, wiping your table down, wiping your bottles down, doorknobs, those kind of things. And then you're going and doing your charting and you're racing out to get your next patient. So you're not really interacting with the other therapists in the clinic so much. And it might be that you're in a clinic where maybe you're the only one that's looking at things like the biopsychosocial or looking at evidence-based practice and things like that. So maybe you feel like you're in a little bit of a silo because you're not interacting with that. So that's where it's important to kind of create your own community and to be around other like-minded professionals that you can feed off of, that you can get encouragement from, that you can also encourage, that you can do mutual learning together and things like that. And that's what we're going to talk a little bit more about tomorrow. But those were just some of the points that I wanted to come on and talk about tonight. So, once you've started to work more into reading research and understanding it, then we want to start working with those clinical practice guidelines. And we're going to want to look at education, reassurance, movement, and massage. And then we're going to want to look at how do we build a community around ourselves where we're getting support and you're learning together and have a collaborative learning environment. Because as that quote goes, you're the average of the five people you spend the most time with. So if you think about those other therapists you spend the most time with, if everybody's learning together and trying to grow, then everybody in that group is going to be better together. And I truly believe that no matter what, we're always going to be better together. So we'll talk a little bit more about that tomorrow. But that's it for tonight. And if you guys have any questions, feel free to drop questions in the comment section. I'll get to answering them for sure. And then anybody who was listening in, I think we went up to like 4 that I saw on there. Thanks for listening in tonight. Somebody just gave a like, but I'm not sure who it is. Anyways, I'll be back on tomorrow night and we'll talk a little bit more about community and where we can go after we've done all these other things. All right, everybody have a good night.